Most common among them is chronic kidney disease at various stages.
It requires carbohydrate, it requires fats, it requires proteins, it requires minerals, it requires micronutrients, it requires vitamins.
Can he maintain such protein intake with his daily food, or does he require some special food supplements for that?
Non-vegetarian food sources, for example, eggs, chicken, fish, are very good sources of protein. They are proteins of high biological value, means whatever protein you take, most of it can be utilized by the body. They are not deficient in essential amino acids. Hello everyone, welcome to the next episode of Kidney Conversations, where we discuss topics of importance and topics which our viewers have expressed great interest in knowing more about. Today, with me, who is a very senior doctor at ONGC, I am Dr. Mukherjee. I am a senior director and nephrologist at Medanta, the Medicity, Gurgaon. Today, we'll be discussing a topic which is very close to the heart of our doctors and patients who have kidney disease. All of them and their family members want to know what to eat, what not to eat. What is your experience and what kind of queries do you get from your patients who have some kind of kidney involvement?
Good morning, Dr. Mukherjee sir. Very well said. Our employees basically who are suffering from various diseases of kidney, most common among them is chronic kidney disease at various stages. So the most common question arises among them is basically what kind of food they should eat, what kind of food they should avoid, and what precautions do they take while in their daily routine so as to decrease their chances of increasing their the grading of the chronic kidney disease.
Most of our patients come up with a very important question. They see their lab tests and they notice that the urine report is showing loss of proteins. Then somebody in their family member or friends or colleagues tell them, look, you're leaking proteins, so stop taking proteins. Now, this is actually a very dangerous form of advice. This advice is like telling somebody, look, you're paying income tax. To reduce your income tax, make less money, take less salary, which actually is not beneficial to you. What we have to realize is the body is more than the kidney itself. You have to maintain the rest of the body. The body requires all major groups of food groups to continue its survival. It requires carbohydrates, it requires fats, it requires proteins, it requires minerals, it requires micronutrients, it requires vitamins. So all of them have to be provided to a kidney patient just like you do to a normal person. In kidney patients, the peculiar stage is that patients with kidney failure are hypercatabolic. That is, they usually have protein calorie malnutrition. They do not build up their protein losses the usual way. So they require actually good quality protein and in adequate quantities. We do not encourage people to take too much of protein. You should not exceed your protein requirements. It's not that you take protein 3 times a day to make it up. But your normal dietary intake of 0.8 to 0.9 to 1 gram per kg weight has to be made up with proteins of high biological value.
Thank you very much, sir. So in this context, I would like to ask you, a common male weighing around 60 kg, can he maintain such protein intake with his daily food, or does he require some special food supplements for that?
That's a very good question. Now, our dietary groups in India can be more or less divided into 2 major groups. One are vegetarians, one are non-vegetarians. Non-vegetarian food sources, for example, eggs, chicken, fish, are very good sources of protein. They are proteins of high biological value, means whatever protein you take, most of it can be utilized by the body. They are not deficient in essential amino acids. Which the best protein is eggs, for example. Unfortunately, in vegetarian food, protein quality is usually very poor. So if egg is taken as 1 or 100% protein, The sources of protein in vegetarian like dal are of poor biological value. They are approximately zero point 0.6 to zero point 0.7 because they are deficient in essential amino acids like lysine and methionine. To make up good protein intake in vegetarians, then you have to take protein supplements like soya proteins, which are extremely high biological value proteins. And in fact, plant-based proteins are protective of loss of kidney function as compared to proteins of animal sources. The problem with animal sources protein like eggs, fish, mutton, chicken is also the amount of cholesterol you get and the fact that the phosphorus levels in these protein foods are very high. So you have to use phosphate binders. Yes, you can make up your dietary intake to a large extent from natural protein sources. In some cases where the patient is either having edentulous state or severely malnourished or has just recovered from illness, protein supplements which are formulated for kidney patients can be given to them.
Thank you, sir. That was about food. Sir, can you give an insight upon what kind of water intake or like there should be some restriction in such CKD patients?
Yeah. So that's a very important question and it is a cause of confusion in most patients. The amount of water a person needs to take in is catered by his urine output. Patients in stage 1 to stage 3 CKD, chronic kidney disease, usually have very good urine output. So for them, we are little liberal about the water intake. So more or less, if you're passing around 1.5 liters of water, urine in a day, you can take around 1 to 1.2 liters of water intake. The rest of the water comes from insensible water from food and other sources. As you progress on to CKD stage 4 and stage 5 and patients of acute kidney injury, these people have fall in urine output, what are called oligurics. In such cases, you have to have severe restriction in your fluid intake. Otherwise, the water goes into the lungs and causes pulmonary edema or cardiac failure. Other kinds of kidney disease, for example, nephrotic syndrome or nephritic syndrome, usually have no water restriction. But the kind of fluid intake definitely needs to be regulated. Fluids with high potassium in them, for example, fruit juices, coconut water, nimbu pani, even the common electral or ORS which we give cannot be given to kidney patients. So kidney patients with diarrhea have to be very careful. They cannot take the normal supplements which other patients take.
Thank you, sir.
So another point which is of tremendous concern to most kidney patients is when they start taking the diet, they want to know what kind of salt intake. Do you get these queries?
Definitely, sir. Salt intake restrictions to restrict the patient or not is a big question because salt being a primary ingredient in all our foods, people want to know about it. So can you give an insight on that, sir?
Yes. There are two major queries which are there in salt intake. The first is the amount of salt. The second is the type of salt. There are a lot of food fads. Patients hear about Senda Namak, Himalayan salt, pink salt, rock salt, Lona, low potassium salts, and they are always looking for ways in which perhaps these kind of salt intake can reverse or arrest kidney disease. It doesn't. You have to remember that all these salt substitutes are very high in potassium and potassium is lethal for kidney patients. So for a kidney patient, we tell them to take the normal salt, the normal Tata's iodized salt. That is what they require. As far as the quantity of salt, we encourage them to take a normal salt intake. What is normal salt? Whatever salt you put in your food while cooking is adequate salt intake. Please do not add salt to the food on the table. Secondly, processed foods. Luckily, India doesn't believe so much in processed foods like processed meats and others. They are extremely high in salt intake, salted fish, salted foods, pickles. So these have to be avoided by kidney patients because the amount of salt intake in them becomes very high, which leads to uncontrolled hypertension. But A kidney patient should not cut down to salt completely also, because sodium is also required for neurological and brain function, and these can be affected by low salt intake.
Thank you, sir. As we come to the next part, as sir said, the potassium is very lethal for the kidneys. So, sir, can you throw some insight on the potassium levels of the patients that needs to be controlled in CKD patients, and how hyperkalemia is dangerous for the CKD patients?
This is the very important topic. Potassium is an ion which is the most dangerous ion in the body. It is very, very tightly regulated by the normal body, and the regulation is done by the kidney, because potassium doesn't affect the kidney, it affects the heart. So potassium levels are tightly regulated by the body between 3.5 to 4.5 in blood levels. High potassium and low potassium can cause cardiac arrhythmia, that is rhythm disorder, or cardiac arrest, from which sometimes it is very difficult to recover the patient. So potassium containing foods have to be restricted. For example, most fruits, citrus fruits, coconut water, nimbu pani, all these have to be avoided by kidney patients. Many patients have a condition called type 4 RTA or diabetics, or they take drugs which cause high potassium. So these patients have to be very careful, test their potassium regularly, and have to take potassium binders. For example, drugs like Lokelma, or drugs like potassium binding polystyrene sulfonates to keep the potassium levels down. Dialysis patients need to be on frequent dialysis and regular dialysis to keep the potassium levels down.
Thank you, sir. Apart from these food and therapeutic drugs, are there any drugs of nutritional value which help patients? These days, patients ask about alpha-keto analogues and N-acetylcysteines. How effective are these in these cases?
There is no scientific evidence for benefit of N-acetylcysteine. It is supposed to be an antioxidant, so it was given. But in clinical trials, no benefit has been really proved. As far as alpha-keto analogues, there is a proved benefit, because alpha-keto analogues, unlike normal amino acids, can give good quality nutrition to the patient without increasing the intraglomerular pressure. So the way to use keto analogues is have a good dietary consultation, reduce the intake of animal sources of protein and make it up by alpha-keto analogues. So what is important here is the dietary modification along with alpha-keto analogues. You cannot take it in isolation and expect things to be working well for you. The second supplement which is coming up in a big way is renal probiotics, where there are special bacteria which metabolize the uremic toxins in the kidney, once in the intestine. As a result, they don't get absorbed into the body and they don't go and overload the kidney. So to some extent, they do have kidney protective effect, but what must be remembered is there is no medication in the planet which repairs already damaged kidneys. I think that's all for today. Your experienced discussion on this topic will help clarify many of the doubts which patients come to their doctors and ask. And what is very important to realize is the patients come to the nephrologist the last. Other doctors will be treating them in multiple specialties, for example, for diabetes, hypertension, and early stages of kidney failure. And your guidance goes a long way in helping us manage our kidney patients well.
Thank you, sir, for your insight.